Hello and welcome to ILTV's Israel Daily. I'm Aaron Porras, and again, before we begin, we want to thank the thousands of you who've already subscribed to our new streaming platform, ILTV+. Your support is helping us to bring you the best and most unique content from Israel every day. Now, coming up in today's newscast, the new Green Pass regulations taking effect despite the still seemingly skyrocketing numbers. Meantime, tragedy in Beer Sheva once again shining a spotlight on police insensitivity. And finally, the Winter Olympics kicking off, but under a cloud of major criticism. To begin, Israel breaking new records yet again with 1,263 serious coronavirus hospitalizations and a positivity rate of nearly 30%, both numbers the highest since the start of the pandemic. But the easing of Green Pass restrictions not affected, with the restriction being lifted from all but high-risk events. So are we doing the right thing, or is our COVID exhaustion just getting the better of us? With me to discuss is Director of the School of Public Health at Ben-Gurion University and an advisor to the National Coronavirus Cabinet, Professor Nadav Davidovich. Thank you so much for being with us, Professor. So again, though, what is the logic in further easing restrictions if infections are as high as ever?
So I think we need to discuss different restrictions in a different way. The Green Pass was about creating safe epidemiological spaces. The Green Pass needed to be adapted all the time to the epidemiological situation. Unfortunately, not enough maybe implemented, but as part of the cabinet of experts, we suggested that actually now this is maybe even creating false assurance by some people, because it's the vaccines are great in saving lives, probably saving about 20,000 people dying, but less so in infections. So now we need to adapt it. And I think it's even a message to the anti-vaxxers that we didn't use the Green Pass in order to force people to be vaccinated. We didn't think that we should cancel it altogether. It still can be used as technology for vaccine passport when we're traveling abroad, or maybe if someone to use it in a voluntary way, or maybe in high-risk situation. What I'm not so happy about is the reduction, the taking away the limits on what was called the purple pass, the purple tag, or whatever it was called,
Sure.
limiting the number unrelated to the question of vaccination. I think these still need to be in place, including
So trying to limit maximum occupancy in stores and malls and things like that. Okay, well, so again, though, let's talk a little bit more, though, about some of these numbers of hospitalizations. Are the numbers inflated at all? We know that they're, the vast majority of the people who are in serious condition are unvaccinated, and we do know that the number of people in serious condition is rising. But how many patients are hospitalized for something not COVID, but then also happen to be infected upon entry into hospital and are therefore counted towards the total?
So between 1/3 to 1/2, depends in different hospitals. We have people that are with COVID, but still the overall picture is very grim, because we have a system that is really overloaded, overwhelmed. After 2 years, people are stressed, some of them even with PTSD. That's something that is not really being discussed. Now, I totally support the fact that we need to continue and live with the virus, but there are so many things that we can do and be much more active. Probably the most important one is encouraging vaccination, not with the Green Pass, but working with local authorities, working with synagogues, mosques, churches, youth movement, whatever you can find. We were very, very innovative in the first phase between December and March last year. And later on, we became very passive. We know for sure that vaccines are saving lives on the individual level and also on the community level. But on top of that, we need to continue wearing masks. There's a new CDC study showing the efficacy of it. And of course, we need to not just count COVID cases. We need to take the mental health aspect, the economic aspects, and being much more active about that.
To watch full episodes of ILTV's Israel Daily and tons of other content from Israel, visit our website at iltv.tv or download the ILTV Plus app.